Dr Naveen Somia is a specialist plastic surgeon and a council member of the Australian Society of Plastic Surgery. He's also the past president of ASPS. He has performed liposuction for lipedema patients since 2013. Today, Dr Somia joins us from the FRACS Annual Scientific Congress in Christchurch to answer some questions about evidence-based management of lipedema. Welcome, Dr Somia.
Thank you.
So our first question, tell us about this condition of lipedema. What is it? Who does it affect and how is it diagnosed?
Lipedema or lipedema is a genetic condition of abnormal fat production and abnormal fat storage. Unfortunately, it predominantly affects women, with about 10% of women affected by this condition. It responds to the 4 classic hormonal triggers you see in a lifespan, namely puberty, pregnancy, menopause, and hormone changes post-menopausal. And the fat deposition is in classic areas such as the thighs, the legs, the arms, and in some cases, the buttocks. Diagnosis is a dilemma, and this is what causes the frustration because there is no scan or a test to diagnose lipedema. The classic diagnosis is done by a series of questions, an examination of the deposition, estimation of the symptoms and the response to the hormone changes, and a typical pattern of deposition in a patient's body is what gives you the diagnosis of lipedema.
Thank you. So once lipedema is diagnosed, how is it managed?
Management falls under 2 categories for lipedema management. The first one is conservative management, and the second one is surgical management. Surgical management usually complements conservative treatment, and conservative treatment is predominantly a method to decongest the legs using compression stockings, mechanical pumps to get rid of the fluid, exercise and muscle activity to decrease the fluid accumulation in the legs, and also a variety of nutritional modifications to improve the dietary condition, and hence the response of fat to that is a very essential part of lipedema management. Once the patient has been stabilized and has a very good non-surgical program going, surgery becomes a worthwhile add-on, and that also helps the patient to maintain the gains from surgery. Once the patient is ready for surgery, by ticking all the boxes of conservative treatment, liposuction is a very effective method of getting rid of the lipedema fat because there is no non-surgical method that we know of today to get rid of the lipedema fat in the thighs, in the legs, and in the upper buttocks and the arms.
Okay, thank you. So talking about liposuction surgery now, I'm interested to know how successful it may be and what are the long-term results for these patients.
Liposuction surgery for lipedema is aimed primarily at getting rid of the amount of fat in those areas. The consequences of getting rid of the fat or debulking the amount of fat is it reduces the amount of fat in the legs. It improves the contour of the fat, and the metabolic component of that fat on the patient's general health makes the patient more mobile, and it definitely gets rid of pain because pain is a classic feature of lipedema fat, not necessarily present in every single area, but certain areas. And this has been shown to improve the quality of life for lipedema patients. What lipedema liposuction does not do is it does not alter the production of the lipedema fat. So the fat will continue to be produced and deposited. And that is not something that liposuction will take care of. You have to use the non-surgical methods to slow down the deposition of fat and the production of fat because conservative methods can control but not cure lipedema.
Understood. I'm wondering, there is mention in the research about liposuction for lymphedema patients, and there's obviously liposuction for lipedema patients. Can you tell me, do the 2 differ? Do the 2 surgical procedures differ for each condition?
The aim of liposuction in lipedema and in lymphedema are similar. They target the excess fat that has been deposited in the limb. With lymphedema, there is an additional precaution that surgeons have to take because the lymphatics have been damaged significantly due to the primary condition that caused the lymphedema. Having said that, in lipedema, the lymphatics are functional, but quote unquote sluggish. So it is very important to ensure that you do not damage the lymphatics, because if you do damage the lymphatics in lipedema, you can trigger off a permanent destruction of those lymphatics and cause lymphedema in a patient who has lipedema. So it's very important to not cross that boundary. So it's important to be gentle, careful, and conservative in doing the liposuction and adopting techniques that are lymphatic sparing or lymph sparing.
What is your best advice for patients considering liposuction for lipedema?
The best advice I can give patients of lipedema who want to consider liposuction is to optimize your health, your well-being, and your conservative management of lipedema using non-surgical methods, because this will prepare you for a successful liposuction outcome, and the success of the liposuction can be better maintained for a lot longer if you have all the conservative methods optimized and done beforehand. It is very unlikely that you will be able to learn to do these conservative methods after the liposuction. So it is best to prepare for them beforehand.
Understood. So I presume you've got a backing of a good multidisciplinary team behind your conservative management as part of your practice. Is that correct?
That is correct. It is a multidisciplinary effort because you need specialist input at multiple levels, because people have tried to do this whole thing DIY, but it is quite a complex problem to manage on their own. It's exhausting, time consuming, and most often we find that patients get given the wrong advice. So having a multidisciplinary team of professionals who not only are lipedema knowledgeable, but lipedema empathetic, which is very important, will help you get the results. These specialists could be specialists who advise you on compression garments, the lymphatic massage therapists who do manual lymphatic drainage, the other people who offer compression pumps and other devices that can help with lipedema management, the input of a nutritionist and a dietitian, because calorie restriction may not necessarily be the best form of treatment with regards to your diet. You need to factor in the nutrition as well. Otherwise, by restricting calories, you may end up with nutrition depletion over a period of time. Having the consultation with the metabolic physician, who's an endocrine specialist who can look at the impact of hormones on body weight, is a very essential tool, in my opinion. And having a exercise physiologist or a physiotherapist guide you through a series of structured exercise programs can be very helpful.
Dr. Somia, what's your best advice for patients considering liposuction for lipedema?
Liposuction surgery is invasive surgery with real risks and real complications. So we would like to advise patients that to consider all the safety aspects of surgery in liposuction surgery as well. You start off with a well-qualified, registered specialist surgeon to do your liposuction. And the best way to look at this is to look at the qualifications of FRACS after the surgeon's name, and ensure that the surgeon works in a hospital that is accredited for liposuction and major surgical procedures, so that in the event of something going wrong, there's significant amount of technical and professional expertise to back up your safety. Make sure your anesthetist is a specialist anesthetist, and your surgeon is capable of providing the good aftercare necessary for your good results.
Thank you, Dr. Somia, for sharing your knowledge and your experience. Lipedema is certainly an area that is poorly understood by health professionals, and we really appreciate your input. For further information about our specialist plastic surgeons and surgical procedures, please visit our website, www.asps.com.au. www.plasticsurgery.org.au.